Welcome to selfdiscoverywisdom.com, formerly known as Self-Discovery Media. On these podcasts, you're going to hear people who speak from the heart. They've taken the journey in life. Many things have happened to them, but they've changed it to happening for them. And in their strength, their courage, they've discovered their abilities and their wisdom, and they are now sharing it here with you. Do enjoy each show. We bring it to you with love and knowing that it's going to help you on your journey of life. Good morning, good afternoon, and good evening, everybody. Welcome back to another edition of Your Health is Your Choice, right here on selfdiscoverywisdom.com. I'm your host, Sarah Troy. My guest today is Tony Holland, and we're going to be talking about something very important, your health and your health insurance. Health insurance expert. He offers consumer tips. ACA open to enrollment begins. Health insurance, I think, is something that's extremely important at the present moment in North America. And a lot of people think they can't afford it. And it's really become something that really can affect people's lives on so many levels. He says, as the Affordable Care Act's open enrolled period kicks off this month, millions of Americans will face critical decisions about their health coverage. And many will see big rate increases that could strain household budgets. Tony Holland, a leading health insurance industry veteran and 3 decades of executive leadership experience in the field, including serving as a CEO of major insurance operations, is available to help our audience navigate these changes and find the best coverage at the lowest price. He offers practical, non-political guidance on how consumers can shop smarter during open enrollment, including strategies, minimizing premium insurance increases, understanding the plan tiers, maximize subsidies, avoid common enrollment mistakes that cost families thousands of dollars annually. Insisting that we are, in North America, I'm in Canada, we have health coverage, thank God. But in America, it's so clearly under threat right now. And even if all of that stopped tomorrow, it's still going to take a while for things to settle down and sort out. And health is extremely important to us all. Without that, we have nothing. It doesn't matter how rich you are. And especially if you have a family, if you don't have insurance, very often, yes, an emergency visit could cost your house. And it would be even more detrimental if you don't own a house. So it's extremely important that people have that insurance. And it really is up in the air right now, isn't it? Nobody knows, where is it going to land? How can I secure my insurance for my family? And they're facing a kind of a rocky road right now, aren't they, Tony?
Yes, ma'am. And I just want to thank you, Miss Sarah Troy. It's an honor and a blessing to be on your show. So, yes, we are dealing with some challenging times. Obviously, over the last couple of weeks, how challenging it's been, especially with our politicians in Washington, D.C.
Mhm. Yes, out of disruption comes order, chaos to
Yes,
order. And a lot of the disruption that's happening is utter chaos and unreasonable. But I think what it will bring about eventually is common sense order. But in
yes,
the meantime, people are getting caught up in the hurricane of it.
yes,
And
yes.
that is, they can't kind of wait for the calmer waters.
All
They
right.
may need help right now.
Yes, yes, ma'am. Well, I think that's why I advise when people reach out to me in other interviews I've done, you need to lock down and hire a someone that's a professional in the business. You need to work with a professional insurance broker. And just so you understand, your audience, there's a difference between a broker and an agent. An agent works with one company, a broker works with many.
Ah,
And most of these brokers, you don't have to pay them a dime. So I want to make
mhm.
sure I phrase that hire properly. Make sure you
Yes.
interview them appropriately. They're
Mhm.
paid for by the carriers, by the way. So
Mm.
their commissions and their income comes from the carrier, not from you. Make sure you check that they're licensed in your state. It's so
Yes.
important, okay? And because a lot of these agents, because disappoints me, Miss Sarah, a lot of these agents unfortunately get into business as a gig job.
Mm.
Please make sure you do your research. No different than you hiring someone to work on your home or hiring someone to work on your car. You need to hire someone that's going to take care of your healthcare coverage that one is state certified and has all the certifications to sell that product. ACA
Yes.
has a certification, Medicare has a certification, and you need to make sure they've actually completed and taken the certification for fraud, waste, and abuse. That is so important. So don't go at it alone. I'm going to give you some
Mm.
tips today that your listeners can do if they want to do their own research. But it's no harm getting a second opinion or two from a licensed broker in your state.
In fact, unless you're a know-it-all, which nobody is, I don't
Right,
care whether you think
right,
you are or not.
right,
Like you may have a dinging in your car and you know that something is off. You take it to the
right.
mechanic because they're the professional, right?
Yes,
You go
yes,
to the doctor or the dentist. I've got the pain. Where is it? Let's investigate, right? So it's
yes,
the same with insurance. You want them to know the ins and outs, the way around it, who's going to really step up and really serve you, who's out to just take your money and gouge you. And you
right,
need to have somebody who's done their due diligence, who's learned along the way, who has some
right.
experience with it as well,
Yes,
because this
yes.
is your health that you're insuring.
Yes. Amen. Amen. And that's why I tell a lot of my clients be leery of going onto some of these websites
Mm,
because what they're doing is creating a lead, and you'll have
mm,
somebody filter that lead and you get someone that may or may not have your best interest. So my recommendation, work with someone that you know, get
yeah.
references, just like
Mm,
you would get a reference on getting your house done, your plumbing done, your electricity
mm,
done. I always ask for three references. Why not do the same thing for your healthcare? A simple
exactly.
question, Mr. Agent, Miss Agent, do you have these certifications? Matter of fact, they have what's called an NPN number. All you have to do is ask for that NPN number. You can actually research that agent on the state
Mm,
site and see if they've handled their complaints or if there are any complaints.
mm,
And also ask for three references. So that way I would ask and say, Mr. Agent, appreciate you helping me out and discussing me before I go any further. Give me three names of people that you've helped in the last 2 or 3 years that are still working with you. Would you
yeah.
do the same thing on your home? Would you
Yes.
do the same thing on your car, as you said earlier? So I don't think people are taking it serious enough. Whether you have
Mm.
employee coverage, whether you have Medicare, or whether you have ACA, please make sure you're working with a qualified individual.
And let's face it, like the internet, it's all very tinselly,
Yes.
squirrel, rabbit,
Yeah.
carrot,
Yeah. Yeah.
and it's like, oh, they say this, they say that. And it's like,
Right.
what we've got caught up as human beings is headlines, and we're not
Yes.
paying attention to content. And we
Yes.
really need to look at the content of like, they've enticed you in. Now,
Right.
where's the ABCs?
Right.
Right? Where's the follow up? And if they avoid that, no, sign today and, get this today, get a free toaster with it,
Right.
but then
Right.
no, right?
Right.
You have
Right.
every right to say no.
Right.
References, 1, 2, 3. Can I
Right.
verify you? If they
Right.
if they are playing hide and seek on that, drop them immediately.
Exactly, exactly. I think the internet is great for research. Do your research,
Absolutely.
but use
Yes.
qualified sites like for ACA. I know that's the topic. That you can go to healthcare.gov. You can go to medicare.gov. Do your own research. Every year, those that are on Medicare, they get the Medicare and You book. They
Hmm.
wrote it so someone with a sixth grade education can comprehend it. Do your own research. Okay,
Yeah.
that's fine, but before you take action, talk to a qualified broker and a qualified broker in your marketplace. If you
Mm.
live in Los Angeles, California, why would you work with a broker in New York?
Yeah.
Work with there are plenty of them, and we have thousands of them nationwide that are in most major markets. Work with someone that you know on a local basis.
Now, I know an awful lot and interview an awful lot of people that are solopreneur. They've gone into coaching or,
Yep.
authors or whatever. And, it kind of, they're kind of like, it's so hard to afford it. I mean, as a family, then maybe two people working and then they can spread it out between them. But as a one person, um, affordability is something that always comes up and always makes the final decision.
Right. Yeah, that's been the biggest challenge. And the Affordable Care Act had the right intention. It was signed into law back in March 23rd, 2010. The full package rollout was 2014. And since then, there's been a lot of challenges. It does need reform. But
Mm,
where we are now, any reform that's going to happen is not going to happen tomorrow. That's going
No.
to be a process.
Yeah.
We all know there's challenges there because it was designed for a good reason to help the uninsured and those
Yes.
that had difficulty getting quality coverage at an affordable rate. We were
Yeah.
told we were going to keep our doctor. That didn't happen. We were told the plans were going to be cheaper than ever. That
Mm.
didn't happen. And matter of fact, with the subsidies that were removed, which was with the whole debate about on
Yes.
in the government, they're going to be removed at the end of next month, which is going to, escalate prices to over 75% or more for some people. And that's going to put a tremendous strain because those subsidies were just put in effect during COVID, during the American Rescue Act of
Hmm.
2021 and the Inflation Reduction Act of 2022. They were just for temporary to help us through the COVID
Mm.
crisis. But it's so difficult when you give a subsidy, it's hard to take it back. So those
Yeah.
over $62,000 a year or more in income are going to see tremendous increases. So
Right.
I think that's important to note, Sarah, to your audience, that yes, it's very challenging expense wise, but we was kind of, I would like to say, it was kind of it's the right word I want to find. It was artificially affordable. Okay,
Right.
it was
Yeah.
art for those couple of years. Now we're back to reality, and now we're getting sticker shock.
Yes. Yes. From my philosophy is that when we invest in humanity, nature, planet, and human beings, we all become enriched. When
Yes,
people are healthy, they work better. They're more creative. There's less anger, there's less crime, there's less anything else. And there are other countries that have put health first, and looking after their citizens, because they know that a healthy nation is a stable nation.
yes,
And yet we have not seen this in America, which is meant to be, the greatest country in the world. But what are we seeing? So much turmoil, and people can still go bankrupt or even commit suicide for the fact that they can't
right,
afford the medical bills.
right,
I know this is, God knows how long it's ever going to stabilize on this, but it's like we really need to go back to the drawing board and go, what is important? It isn't the
yeah,
pharmaceutical companies getting rich, right? It isn't um, the administration getting rich. It's the help people that are sick getting poorer, and it
yeah,
really needs to be revamped
yes,
completely. But
I agree.
in the
Yes,
meantime, while people are waiting for someone to step up and do that, actually do it, not
right,
talk it, um, people are getting sick, and we're seeing more and more people getting sick due to anxiety, due to unsure, are they even going to have a job tomorrow?
right,
Um,
I
and
agree.
this is something that puts so much strain on the entire nation. It's very hard for people to kind of even think about insurance when they don't even know if they're going to have a job tomorrow.
Right. I agree, Sarah. And that's something I've always promoted. And a lot of my carriers I work with, especially on the Medicare side, getting more quality mental health care is
Mm.
important.
Hmm.
Also, we have programs that help people get back in shape, like the Silver Sneakers Club is part of the Medicare program we offer for with many carriers. It's a proven fact. If people get the right type of mental care, which I think
Yes.
we need more of that than ever now,
Oh my
and
God,
number
yes.
two, get themselves in shape physically. I believe
Mm,
if you're in shape mentally, spiritually, and physically,
mm.
you're going to live a better quality of life.
Amen.
And
Yes.
that's something I've been promoting, not just in my business world, but in my own personal life, is that we are a sick nation, but we're
Hmm.
not just but we're sick on multiple levels, and
Yes.
it starts with I believe our society embracing quality health care, like you mentioned before, other countries that are out there that put it as a priority, and we have to understand. We got to get the profit and margins and the in making money out of it, and let's put
Right.
true health care first. So we do need real reform that
Mm,
makes sense for everybody, whether you're 25 years old or you're 85 years old. We need to have
mm.
a health care process that makes sense. And we also need to make sure, to make this more affordable, because that's something I always address with my audiences. We got to get the fraud out of the system.
Yes.
We got to get the waste out of the system, and we got to get the abuse out of the system. That's what Doge uncovered, not just in healthcare, but many departments in our government. It's frustrating for an insurance professional like myself seeing money going to places that it shouldn't be, or going to people that don't deserve those benefits when the true people that need this health care are suffering at the same time.
But I also think that there has to be a leveling of pharmaceutical.
Yes.
Why are people paying thousands of dollars more for a medicine that in another country is pennies? And there
Yes.
has to be a complete reform over the pharmaceutical
Or
because it's like only if you're rich can you afford the medicine.
yeah, that is a challenge for me. And I'm praying our administration and say they're going to make a commitment to change, and I believe it's going to happen. But it's not just with medicines. It's all aspects of healthcare. I mean, there's certain procedures that are done for 80% less in other countries, but you come here and it's way too expensive.
Yeah.
And different parts of the country are different than others. I think they just need that. We need what we really need is not just reform, but some type of stabilization. He could put people at combat. Hey, this is the coverage I can count on, and that it's less complicated because it's very complicated. I mean, there's so many options and so many variables in healthcare. It makes it confusing, and that's
Yes,
why it's so
yes.
important to have a broker. It's like trying to do your own taxes.
Yeah.
If you're running a business, trying to do, it's almost impossible. You have to have a CPA
Mm,
or representing. It's like trying to represent yourself in court of law without a law degree. You
mm.
need someone to guide you through that process.
Exactly. And especially as the language they use is very highfalutin. And
Yes.
unless you have a degree in something, you don't know what the hell they're saying. And then there's always that little thing in small print or
Yeah.
innuendo. And you go, but
Right.
I thought I was
Yeah.
covered that. But yeah, but
Yeah.
on
Yeah.
on paragraph 52,
Right.
on such and such a line. And
Right.
then if you don't have somebody who knows that,
Right.
right, then you're going to be in trouble. So
Right.
it's
Right.
it's not just getting the insurance, it's protecting you from the
Right.
insurance too.
Exactly.
Make
Exactly.
sure that you are actually covered when you have to make a
Yeah.
claim.
Especially all the acronyms.
Oh, yeah.
Just understanding all the government acronyms in healthcare can be confusing. So, some tips I'll give your audience, if you don't mind,
Mhm.
I give to help them in this process, because as we said before, we need reform, but it's not going to happen tomorrow. The open enrollment period started November 1st, which was 2 Saturdays ago, and it ends on December 15th. So they have to make it, especially if they're an ACA. The annual enrollment period for Medicare started October 15th and goes till December the 7th. So there's a short window
Mm.
for your coverage for next year. You need to make a decision and send. So some quick tips. Make sure you actively shop around. Okay. And look at premiums, look at the benefits, look at the providers, because every year it changes, whether you're in
Yeah.
ACA or you're in Medicare, it changes. Number two, focus on the annual cost, not just that monthly premium. So look at
Mm.
that. No, the maximum out of pocket has changed for 2026. It's 10,600 for individual on ACA and 21,200 for a family. So make sure you look at the full picture of the outgoing expenses. Make sure you consider other options like there's health deductible health plans, which I like, is also health savings accounts. So it's like an investment account, which
Mhm.
allows consumers to have triple tax advantages. It's tax-free money going in. The investment that it's in grows tax-free. And then when they utilize it, you have to use the money for their Medicare medical coverages. It's tax-free. And if you don't use the money each year, it rolls over. And if you
Oh,
don't
that's
do
good.
it by the time you retire, by the way, Miss Sarah, you can roll it over into your retirement account. So those are
Aha.
great options,
Yeah.
especially for young people. Because what I recommend to someone that's young, get a bronze plan and get a health savings account. That's going to be tremendous for you. Make sure you take advantage of tax credits that are available to you. Meet with your tax professional and maximize those subsidies that are going to be available. Because I think what the government's going to do, they're going to have to make some kind of bridge to one day reforming. They're going to probably have to extend something to get
Mm.
through this process so that people aren't dealing with the sticker shock. So look at that. Check on your network, because whenever you go out of network, a lot of people don't realize there is a network for most plans. If you go out of that, it can double, even triple your expenses. So look at that. And two more pointers: review your prescription drug coverage, because a lot of the tiers have changed. There's a lot of changes there. They need to look at that and utilize preventive maintenance services. A lot of these programs are zero premium. Those are designed to help you stay healthy, just like getting your oil changed at Jiffy Lube. You do
Mhm.
certain procedures and screenings and exams and vaccine and to help you stay healthy. So make sure you take advantage of them. So those are some key pointers I wanted to share with your listeners.
Excellent tips. And you know that this particular genre is called Your Health is Your Choice. And
Yes.
we may not choose what happens to us, cancer, heart disease, or you had an accident or whatever. But what we do about it is
Right.
is that now initially we need medical help to help us through. whatever, but then we have to be proactive in our own health. You know,
Right.
the mental health of dealing whatever's been handed to you. And then what can I do physically? Diet, exercise, meditation, whatever I need
Amen.
in order to assist the medical. And a lot of people just hand themselves over to the doctor and say, fix me, and take no accountability whatsoever themselves. And we have to understand this is our body. We're living in it. The quality of our life is up to us. And so we do need to look at diet, exercise,
Yes.
our stress level. What are we feeding mentally?
Mhm. Right.
What are we seeding possibly? And
Right.
work with your doctor or medical field, but be proactive in your own health. And I think that's something that's not advocated enough. I think, a lot of it is just, again, I go back, I'm very anti-pharmaceutical and they're gouging.
Right.
It goes, oh, there's a pill for that, there's a drug for
Right.
that, there's a that for that. And it's like, well, why don't we get to the bottom of why you have it in the first place, the root
Agree.
cause? All right.
Agree.
And from the root cause, what can they help you with and what can you help yourself with?
Exactly. And also, I would add to that, sir, very well said. Agree with you on that, but also look at alternative options in terms of your healthcare,
Absolutely.
like
Absolutely.
acupuncture, there's Eastern
Yes.
medicine. There's a lot of new things that are out there that people aren't researching or looking into. But you made a very good point. You only get one body. That's
Yeah.
it. You can always get another
You can't
house.
trade it in.
You can always get another car. You can always get, whatever product that's out there, a new iPhone or whatever, but you only get one body and
Exactly.
it's yours to take care of it. So that's
For
why
the
going
rest
back
of
to what
your
I said
life.
earlier. What's that? I'm sorry.
For the rest of your life.
Yes, ma'am. But it's like I think it's as we said earlier, and it goes along with your shows about you got to take care not just your health
Mhm.
physically, but take care of your health mentally and take
Absolutely.
care of your health spiritually. And I know we're
100%.
seeing an uptick, people getting back involved in their spirituality. I think that's a key factor, and especially with what's all going on the internet now, the stress and the
Hmm.
negativity, the media, all that's by design to get people addicted
Yes.
to that nonsense. I believe there's a lot that's going on with keeping people divided. And, but in my life, I have no room for anger. I have no
Mm.
room for hate.
Too busy.
Just that alone, if you
Mm.
can eliminate that in your life, you're going to have a better quality life and better health care and better outcomes.
Amen, 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 amen. And the point is social media all has its place. When you look at it,
Yes.
everything is an algorithm. What you feed is what you're
Yes.
going to get, right?
Yeah.
I'm very much about what we seed and what we water, or what we feed
Yes.
is what's going to grow.
Right.
So if you're going to feed the anger and the discontent, now that's got nothing to say about standing up against something that is harming people or harming yourself. That's
Right.
totally different.
Right.
Stand up for what is
Right.
right. 100% agree with that. But don't do it with the pitchfork. Do it with common sense.
Right.
Do it with intellect,
Yes.
but also do it from the heart, soul, and the spirit. I'm very much a spiritualist.
Amen.
That's who I am. I come from that, and that's very much what governs me. And that equilibrium is your core truth resonating with your heart, going to your spirit in action for your mind to know what it needs to know when it needs to know it. And that
Right.
knowingness will always lead you calmly down the road and help you look at things more clearly and not jump in and buy the headlines and the sensationalism. Because when they sell that, they're selling that to keep you in fear. When you're in
Hmm.
fear, you're easier to control. You're not going to
Agree.
think for yourself. You're not going to research for yourself. You're not going to inquire for yourself. You're not going to stand up for yourself. And so that kind of fear thing then starts manifesting not just mental, but physical, spiritual, emotional. And that's when we start seeing anger and violence and everything else come out of that. So we have to go back to a well nation. And that well nation is not just government, it is us supporting each other on
Yeah.
being well. And it starts in the mind for the body to feel at ease.
Yes. Very well said, Sarah. Matter of fact, I have a saying when I do a lot of public speaking, I say whatever a lot of motivation in building
Mm.
businesses and other parts of life, but I have a saying I've been using from over 20 some years. Whatever you think about,
Mm.
whatever you speak about, you're
Mm-hmm.
bringing about in your life.
Yes.
They've done studies on criminals that are in prison, and all the research shows 100% of the time before they committed the crime, it started here in the mind,
Mm-hmm.
went to the mouth, and then it came about in their life.
Yeah.
Okay, no one's born a criminal.
Right.
Okay, no one's, no one. It just doesn't happen in a split second. It starts in
Mm,
the mind.
mm,
Multiple times they think about it, or they're seeing it on TV, or they're seeing it on the video games,
mm.
or they're hearing violence and around violence, and over time they're conditioned. They're
Yes.
conditioned through the mind and through the words they use, and sooner or later they start acting out what they've been seeing and hearing and
Mhm.
projecting.
And that is because they're not connected to the heart, the soul, or the spirit. Where
Amen.
that's where the wisdom lies. And the
Yes.
head gets so confused and it talks itself into something, and that head is just churning around, churning around, churning around without the wisdom from the heart, soul, and spirit. All you're
Yes.
getting is data, and that data keeps turning, turning until you've got to such a point it becomes the enemy. Right. So
Amen.
if we go back into our heart, soul, and spirit, God, universe, soul, spirit, source, energy, I don't care what you call it, attached to something that's a higher wisdom, and let
Yes.
that be our compass, let it be our guidance system, then the mind will not have so much dominance over us because the
Yes.
wisdom tells the knowledge what to think.
Yes. It's a proven fact, Ms. Sarah, right on point that those that are spiritually aligned
Mm-hmm.
live better quality of
Yeah.
lives. Their marriages last longer. They have a better quality of health,
Yep.
definitely better quality of mental health, and
Yeah.
they live longer, and they're more, and they have a more joyful life. So
Karma.
yes,
Yeah. I mean, it's just like, as I said, you can still stand up for what's wrong, but what you don't
right,
become is the pitchfork and the hysteria,
yes,
and we've
yes,
seen how that happens. Somebody says something and it's, let's go out and get them. And it's
yeah,
like, no, calm down.
yeah,
There is always the two sides of the story, right?
yeah,
And when somebody gets to that point of apathy that they've got to go and hurt somebody either for their own pleasure or because they're so utterly disconnected to them, to the heart, the soul, the spirit, then I put out a book last year called Our Forgotten Children, and it's actually kind of a lot to do around this. It's an anthology, and each person contributed a chapter around their expertise in the raising of children. And mine was actually around, at the time, there were so I think three or four young girls that met online, and they were kind of after COVID disconnected to people outside. Everything became online. I don't know what happened, but they met for the first time and then stabbed someone to death just to feel
wow,
something.
wow,
And that is like, I don't look at them as being bad behavior. We've let them down. We as a
yeah,
society have let them down. And the reason why we have so much horrible anxiety in our children, where they turn to the violence, where they turn to hurting others because they want to feel something in themselves, is because of what we're doing in society. We're not
yes,
putting the emphasis where it should be. And that
right,
is on life, whether it's life of
right,
planet, life of nature, life of each other. It's
yes,
become money driven, popularity driven, fame driven, and not
right,
humanity driven. And I think
right.
we would be a much healthier nation if we go back
Amen.
to that.
Well, you had another good point, Miss Sarah, and there's a phrase I used to use back in the day that hurting people hurt people.
Mm-hmm,
Those
mm-hmm.
kids are hurting. I think
Yes.
COVID did a big service to our young people because they didn't know how to cope with
No.
what was going on. And then they had to do their learning and training, online. And then a lot of them there were gates open to them that they've never experienced
Mm-hmm.
when they were in the classroom. So they were flooded with the wrong kind of input, just like a computer, wrong input, wrong
Yeah.
output. So
Yeah.
these children that you're speaking of, they're
Mm.
hurting people hurt other people.
Exactly. Exactly. And that is something we need to kind of look at as a nation. Um,
Yes,
as a
I
nation,
agree.
it is, a lot of people keep pointing to the government, fix this, fix that. And I said, no, how about we come together as a community?
Yes,
Why don't we look at how do we enrich or how do we make our own community abundant? And this has got nothing to do with money other than putting money in the right places and
right,
supporting organization and places that are supporting people.
right,
But we've for so long it's about the multi-billionaires at the expense of the poverty, and we need to
right.
start seeing going back to the community that looked out for each other, looked out for each
Right.
other's neighbors. Children could go and play on the street because you knew the neighbors were all watching them,
Right.
right? Let somebody, Joey's over at my house,
Right.
and we don't
Right.
have that anymore. People have closed their
Yeah.
doors and they've
Yeah.
shut everybody out. If we want to
Yes.
heal physically, emotionally, and spiritually, we need to come back together.
Yeah, I agree. And our government can't solve all our problems.
No.
But we need to, as a community, whether it's your community of your household or your surrounding neighborhood or the large community, we need to get back to that. Those good, I call them the good old days. I grew up in the
Mm.
70s, and you're so right. My mom knew what I did all day long because three or four neighbors told her what I did for the day. So when I got home, she knew exactly where I was, what I went to,
Yes.
because it was you were being raised by a village, you know.
Exactly.
And and
Exactly.
and back then, I can remember people borrowed eggs from each other, borrowed
Uh-huh.
sugar.
Uh-huh.
People looked out for it. I used to remember they would make phone calls. I'm going to the grocery store. Do you need anything?
Hmm.
So I think we've isolated ourselves because I think a lot that's going on in the internet. We see all this evil and disaster and challenge, but probably that stuff sells.
Yeah.
That's why they promote it on the news because it sells. But I think we need to kind of shut a little bit of that down and get reconnected to not just our physical community, but our spiritual community. I think people need to get back to whatever their religion is, get
Yes.
back into the church again and have that bond and that community feeling on that level as well.
I was born in the 50s.
Oh, wow.
So I used to
Well, you
take
look
my,
good, young lady.
thank you. I used to take my pram with my dolls and just go around the neighborhood. And
Yeah,
long as I was back for lunch or dinner, right?
yeah,
But I will say this. Pedophilia today seems to be rather like narcissism
yeah,
and a pandemic of its own.
yes,
And we had pedophilia back then, but nowhere near the way it is today. And let's face it, the deep dark web has ignited a lot of that in people.
yes,
And I've done quite a number of shows on this, the sickness around this. And it is a sickness and it needs to be treated as a sickness. And I think for a lot of people, they would never have acted on it until they started watching it. And then I have the urge, I have to do it.
right,
Right. And now our children, I've got three young grandsons, a newborn, and
right,
two other little grandsons. And we always want to keep them in lie level. And that is
right,
because people are afraid now because we don't
yeah,
know our neighbors, we don't know this and that. And I think we have to look at where is the sickness? How did it
right,
come about? It's not just about the band-aids and the pills and the operations. We've got to get to the root cause
right.
of what all of the sickness is: mental, physical, emotional.
Amen. Yeah, as you said, pedophiles have been around since the beginning of time.
Yeah.
But unfortunately, the blessings of the internet, there's some great things you can learn on the internet. You can get a college degree on the
Yes.
internet. You can read any book in any library around the world. But with that came, it's like with anything else, TV, music, movies, whatever there's something that's ultimately good, there's also evil that comes out of it. And I truly believe we do have a problem with pornography in our
Hmm.
country, and that has
Hmm.
100% to do with the internet. It
Yeah.
opened up a gate that was never there. Back when I grew up, that kind of stuff, you had to go to the big cities and go to these red light districts for that. You didn't have it come into your household. You didn't have,
Exactly.
and I can remember like what was like an R-rated movie when I was a kid.
Yeah.
That's PG now.
Yeah,
It's
no.
amazing what we're willing to tolerate. These young people are seeing things we never saw,
No.
back in our day. It was
Yeah.
that was highly unusual. That would
Right.
never have happened. We never have thought of the things that you can see now on the internet, and it's crazy. So I would love to see some type of regulation in that regards, in terms
Yes.
with what is like. 'Cause obviously, it's created crisis. We have things that are going on in that world that it's just unthinkable how women are treated, even not just children, but how women are treated.
Yes.
I just think there needs to be some type of reform in regards to that industry because it's shocking. It's just shocking. I don't want to get too graphic, but there's things out there that, I heard on the news this lady that was bragging about her body count. I'm like, I never heard of a woman say that when I was growing up,
Hmm. Yeah.
but now that's glorified. We're glorifying this bad practice. So I think there needs to be
Yes.
some reform there.
And we also are sexualizing our children way too
Yes.
early. And it's like,
Yes.
let them be children, let them be
Yes.
goofy uh, teenagers with a crush. Stop
Right.
sexualizing them because, let's face it, at those teenage years, there is no
Yeah.
common sense there. They're just
Right.
driven by hormones. All right.
Right.
And if you desexualize it and just let them have their crushes but not act on
Right.
them
Right.
because of the sexualization, then we probably have less,
Amen.
unwanted children or a
Yeah.
fear of abortion or anything
Right.
else, right? It will always happen, but I don't think it will
Right.
happen on the same magnitude. And that's going
I
back
agree.
to us as what is health? It isn't just
Hmm.
a healthy body and a healthy mind and a healthy spirit. That is what we all aim for.
Right.
And yes, we need insurance from the physical.
Yes.
And from when we have mental troubles, we need qualified people to help us through it. But a healthy nation is also one that steps up with their own accountability and brings back the village. Even if you live
Yes.
in an apartment building, find people that are your vibe tribe,
Right.
right? Make sure that maybe once a month or one couple of times a month that you all get together at someone's
Right.
flat, or
Yeah.
you get to know whose children are playing with whom. It's
Yes.
like, please be proactive, stop being so
Yes.
insolent and get it
Right.
out there, right?
Right. Well, it all starts in the home, Sarah.
Yes, yes,
Everything
it
you're
does.
talking about starts in the home. I
Mm.
grew up in a single parent household. I was one of those latchkey kids because my mom had to work two and three jobs. Matter of fact, I want to give a shout out to my mom. She never took SNAP, never took welfare. She could have, would have qualified, never even took child support. She wanted to make it happen and she instilled that discipline in us. We never had to, be on special assistance, but it started in the household. I was more afraid of my mom than the police.
Oh, yes, yes.
I thought she was a Zorro in a previous lifetime because she really knew how to use a belt, and that was probably the best therapy I ever got to stay out of trouble. All it took was one time, and that was it.
Yeah,
Of course, you can't do that nowadays, but back in the 70s, that's what you did.
yeah,
If you screwed up, there was a price to pay. But I think also a big point we need to drive home, especially in certain ethnic groups, that we need to make sure we have more representation of men in the household, which is
yes,
one of my biggest thing that I've been a part of over my 30 years in business. I've helped coach, I've helped develop young men and be that male role model in their life. So I think that's something we need to get back to the boys and girls clubs. These young people need strong, masculine
yes.
leadership, men in their lives.
Yes, 100% agree with you there. And men that stand up and be accountable,
Yes,
not abstaining. And we also have to look at it this way. There is a massive transition to women stepping into their empowerment, to becoming independent and individual. And a lot of the pushback from women is that I'm just not going to put up with the misogyny or the
right,
violence or the degrading or the demeaning
right,
from men anymore. And they've almost kind of gone pendulum the other way.
right,
And we can't blame the men at the present moment for not knowing what to do next. We have to train them.
right,
We have to train them that what a woman really wants is a partner where you are both equal. This is
right,
my skill. This is your skill. This is who I am as an individual. This is who you are as an individual. And this is who we are as an us.
right,
The us is strong because the individual is strong,
right.
right? And not like you complete me, but you complement me. And
Yes,
a man's being brought up to be misogynistic and telling women what to do. We now need to show them how to embrace a woman and all that she
right,
is and be able to step as an equal partner without dominance. No one
right,
person having dominance. That's not going to happen just in one generation. It is
right,
happening. My daughter is married to someone like that, and it is certainly happening, but it needs to be more promoted of looking at each other not as our sexuality, but looking at each other as the heart and soul of who we are.
right. Exactly. You made a lot of valid points there, and I agree that it needs to be a complement of
Yes,
each other because there's certain things obviously a woman can do that I can't do. Like she can have a baby.
exactly.
I can't. I don't care what anybody else says. I can't have a baby. I don't, you can tell me all day long. No, men
Even
can
if you're
have
Arnold
babies.
Schwarzenegger, right? You
Yeah, I
can do
cannot
it.
have a baby. It's not going to happen. Okay, I don't have a uterus. Okay, and there's other things that men can do
Yeah.
that obviously a woman is not going to be able to do. But together, they
Yes.
act as one, and they work
Yes.
together with love and compassion and empathy and
And
support
support.
for one another. I've been married for 27 years.
Right.
We're going on 30 years together, which in a couple of months. And we didn't have our, there's been challenging times, there's been
Yes.
ups and downs. That's just part of it. But
Yes.
the one thing is, we were united as one. We had a
Mm,
strong faith. We worked
mm,
together. There's things she does I can never do.
mm.
She is great at certain aspects like numbers and accounting and finance. I'm great at sales. I'm great at marketing, but together we complement each other.
Right.
And I think that's what a marriage is supposed to be about. And then she
Yes.
did most of the raising of the children. I was there obviously because, that was why I chose the profession I did. I didn't work a 9 to 5. I had a lot of flexibility in
Mm.
building my businesses, but we worked together.
Yes.
She played her role, I played our role, but we played them together just like a play. Every
Exactly.
actor has to do their part to make the play work together.
Exactly. Exactly. I kind of draw the analogy of the orchestra. Each one of us
Yes.
is looking to be, what instrument am I? How do I
Right.
play? And as a soloist, I can play very well. I can entertain
Right.
very well. I can stand on my
Right.
own. When I join the orchestra and each one of us play in our own strength and agree to play harmoniously together, we become transcending. And
Exactly.
we want transcending relationships,
Right.
transcending villages and
Right.
communities. And that means that we've got to recognize each other for each other's strength and not prey on the weaknesses. I'm a true colors coach in a personality traits, right? And each one of us has 2 or 3 traits that are really strong and one that lives next door. Right? Stop trying to be the one that lives next door. You weren't designed for that. You
Right.
align yourself with somebody that's their top trait, right? And this is what you form under your umbrella, everybody with their
Right.
own instrument in order to make a great band or an
Right.
orchestra. But
Right.
we've become a society where we point out, well, you can't do this, you can't do that, you don't look like so and so, you don't earn
Right.
enough, you don't this and
Right.
that. And that belittling and
Right.
that demeaning breaks the soul and the spirit down, which then
Right.
causes dis-ease and disease. So
Yes.
we've got to stop doing that. We've got
Yeah.
to be supportive of what a person can do,
Right.
right? Because that's their strength. That's what they were
Yes.
designed to do.
Yes, I agree 100%. I speak a lot. It's funny how we changed gears. I love it. But I speak a lot to young audiences about marriage, and one of the things I tell them, the most important decision you'll ever make in your life is not your career.
Mm,
It's not the city or state that you live in, it's the person that you marry. And
yes.
I tell them there's a checkbox. You need to know their love language and you need to
Hmm.
know your own love
Hmm.
language, and I think that's the way you can understand. Like, I know my wife's love language. I know she likes to communicate. She loves to talk. She loves to be in on things. I like my priorities. I like to be touched. I like to be
Mm,
appreciated. I love hugs. I'm a
mm,
feeler. So we have to learn each other's love languages, but also make sure you have your check the box. I go through a check box with men and women. Make sure you check the box. And it's not
yeah.
just physical. We all love the
No.
beauty. Everybody wants a Tom Cruise or, a supermodel girlfriend, wife, but do they check
Mhm.
the inner aspects? Do
Yeah.
they have the
Yes.
spirituality that lines? How are you going to raise children together?
Yeah.
Where are you going to live? Who's going to be the primary caregiver? What are we going to do in terms of discipline? What are we going to do if this happens? How are we going to manage money? Most people fall in love. That's the easy part and have lust for each other, but
Yes.
there's dozens of other checkbox items you have to look at before you make that next step. And I think we do that, especially the ultimate decision maker. I always agree is the woman. If she makes a decision, say yes to that gentleman,
Mm,
make sure he has all those check the boxes,
yes.
okay? Because ultimately, the lust and then
It
the,
was
the
out.
the the good luck looks in a few years.
Yes.
He's gonna have a dad bob. Are you gonna be okay with that?
And that's the thing is that when you see people from the inside out, that's really where the beauty lies. This is just the
Amen.
casing that holds the spirit, that holds the soul.
Yeah.
And it can be kind of the peacock that draws you to the person. But if you're so shallow that that's all you see, and you don't see that beauty and what lies
All right.
beneath, then again, you're a headliner, you're not a content person. You're
Yeah.
not looking for depth. You're just looking
Right.
for an instant thrill.
Right.
Squirrel, off you go. Next one,
Right.
the attention.
Right.
There's so many people with ADD now.
Right.
And
Well,
it's like, where's the
I,
value?
exactly. And I think another point I'd like to add to that, for me, my most important thing is peace.
Yes.
And I see that a lot of older gentlemen, because I talk to a lot of older men, because what did you do? You got this beautiful, attractive supermodel wife, and when you guys walk into the room, it lights up. When you meet my wife, everybody's like, "Wow, she just glows."
Yes,
And I
yes,
always had a saying that you'll see a man's validation of who he is seen through his wife,
yes.
and
And his children.
and his children. But the key thing that that I try to stress with those older gentlemen, more mature gentlemen, and we have these same conversations. You know what they tell me they're looking for most, these 50 plus guys? Peace.
Companionship.
And
Yes.
well, they want peace first, but companionship with
Yeah.
peace.
Yes.
Because after your 20s and 30s are done, the chaos, they
Mm.
want peace. But
Yes.
I think that should be important, not just in your 50s and above.
No.
You
It
should
should be a
want
fruit
peace in your
in the.
20s and 30s.
You can still have excitement in that piece.
Oh, absolutely.
You can still have, the thrill and the excitement. Of course, go and do it. You're young. That's when you can. But
Yes.
also, when you get older, I'm 71. You don't stop exploring life. You
Yeah,
just explore
exactly.
it in a different way. Different things mean differently to you now. You're exploring
Right.
different avenues, right? And
Right.
what I miss in my life is that companion I could do it with.
Right.
Right, like
Yes.
we can go and explore this. We can have a conversation about that. We can go and do that, and that's something I miss.
Yeah.
That
Yes.
it's for. I'm sure there's men out there looking for the same thing. It's just
Right.
finding them, because what
Right.
you do see is the men going after younger women, right?
Yeah, I see a lot of that here too, but that's also an inner challenge they're
Oh
having.
yeah.
That's more of an accomplishment. It's like getting a new Ferrari. I see that a
Mm,
lot in Miami, and the new yacht and all that. And I get it, and God bless him. He's 70 years old, and that's what he wants to do. God bless him. But
mm,
I'm talking about real companionship, real
yeah.
relationship starts one in the spiritual realm. It starts there first. The
Yes.
chemistry on the physical side is great, but you got to have the chemistry in the inner soul. They need to
Heart and
mesh
soul.
first and foremost. Exactly.
Absolutely.
Going
Your
back, you said
vibe tribe. Yeah.
heart, soul, and spirit. You said
Absolutely. That's where, because the mind will be more at peace when the heart, soul,
yes,
and spirit is in the driving seat,
yes,
right?
yes,
The connection physically will be more
right,
trusting and more
yes,
trusting of what it is when it's the heart, soul, and spirit connection,
yeah,
right? And because the greatest gift you can give anybody is your vulnerability in trust,
yes, yes,
right? And you want to know that you can be vulnerable with that person in trust. And if that trust
right,
is betrayed, it's very hard to get
right.
back.
Yeah,
So,
and that's why I always stress to people that that one of that first check the boxes you have,
yeah.
that you're spiritually aligned.
Yes.
My first date with my wife wasn't to a nightclub, wasn't to dinner,
Mm-hmm.
it was to church.
Mm-hmm.
We knew we liked each other. So, what are you doing Sunday? Let's go to mass together. And she was shocked. She goes, I'd love to. And
Yeah.
we've been together ever since. So, I mean, we're Catholic, so mass is what we call our church
Right.
service. But make sure you're at least on that alignment together
Yeah.
spiritually, and then work on the rest of that. But if you're not,
No.
on the same connection and that compatibility you use
Yeah.
on the spiritual side, there's nothing, there's no help in that relationship.
No, there isn't. It will be a titillation for a while and it will fall by the
Yes.
wayside, because
Yep.
that spiritual connection is your heart and soul speaking to each other. And it then will calm everything else down. It will open everything else up. But without that, it is not a true connection.
It's
And
called being a
and
soulmate. Soulmates.
exactly. And
That's
and
that's
uh, and
important.
that's what we all look for in life. And some people find it. I'm going to be getting a dog. There goes my companion, right? My little soulmate. I have three little grandsons. They're my little soulmates, right? So
Oh,
we can give, love wherever. And I think that's something
yes,
that's also something that people have lost connection with, which I do believe what makes them sicker is
right.
that when you have become jaded and you don't trust love on any level, and so many people have lost the love of life, the love
Yes,
of being alive, the love of possibilities. They can't see them because they've just, oh, I've been beaten up too much, or I trusted, I'm never going to do that again. No, you're denying your heart and soul. You're denying
right,
your spirit. You're denying your purpose. And also, you are creating your ill health, because
right.
once that starts breaking down, everything else starts breaking down.
Amen. Forgiveness is so huge that we need to
Yes.
implement in our life. I'll be honest, that was probably one of my greatest challenges. I was abused as a child, went through a lot, bullied in high school and even in college. I just went through a lot, Miss Sarah, and just a whole nother level, which would be a whole nother program. But how I overcame that, my number one challenge was forgiveness.
Yes.
It took me years, like my mom and I were estranged for 20 years, and it wasn't the moment that I was freed and when I was able to forgive. We
Mm,
need to forgive our abusers. We've all been abused. We've all been
hmm.
hurt. We've all been
Exactly.
picked on. We've all been lied to. We've all been stabbed in the back. You have to have the power to forgive, not for their benefit, but for
For
your own
us.
inner peace.
Mm.
And it took me years of work and therapy to figure that out. That was the most freeing moment in my life, whether it was a business deal that went sour or a personal relationship that went sour. It doesn't mean I need to be in a friendship or relationship with them, but I need to forgive them, forget it, and give it to God and let it go. You just got to let it go and move on.
I know, and I did this with my ex. It was very tumultuous. I lost myself, and I actually became very, very sick because
Wow,
he's
sorry.
from the Harry Potter. He was the Death Eater, sucking
Wow.
the life out of me, right? And but I chose that it was not going to be a nasty divorce. I kind of planned it that it would be something that would be the separation going by the wayside. I had to take onus that I didn't stand up for myself, and when I finally did, he said, "I've lost the control I had over you."
Yeah,
I had given him the control.
right,
Unknowingly, I had given him the control. I need to own that. When I
right,
took back my control, then he couldn't do to me what he was doing. So
right,
we're both wrong. He's got to own the boots,
right,
right? But I've got to own the fact that I stood there and allowed him to kick me,
right.
right? So
Wow,
I've forgiven him for what he is because I know where it's coming from.
right.
It's his own insecurity. But I had to forgive myself for allowing it to happen
Amen.
to me. Right.
Amen.
And I saw him the other day when he came over to see the new baby. We walked our daughter down the aisle together, and I can talk to
Right.
him just like somebody I know. Right.
Yeah.
He gave me three wonderful children. Thank you.
Yes.
And that's it.
Well, and one thing I think when you did made a great point there, Miss Sarah, you started appreciating at least the good that came out, even though as horrible
Yes.
as that was. And
Mm.
I commend you on your growth in that process, but I know it's not easy. But when you can at least say, at least they were good at this, at least they were
Yes.
good at that.
Yeah.
I appreciate that business partner for what he did
Yeah.
do, horrible what he did do, or that spouse, or
Mm.
a lot of people, the issues you're talking about are intimate.
Yeah.
Husbands, wives, moms, dads, siblings. And I
Mm.
see it all the time. You got siblings that have been fighting for 30, 40 years.
I know. I
They're
don't get
brothers and
it.
sisters, and they're
I know.
draining each other. They're
Yeah.
making each other sick. They drive each other crazy at every holiday. And I was counseling one of my first cousins the other day, and she's had some traumatic things happen in her life and childhood. And the main thing is she's got an older sister that just is like your husband, a drainer. She is like
Yeah.
a spiritual vampire, and she
Yeah.
doesn't know how to let it go because it's almost like a spiritual malady that's
Yeah.
going on, and she doesn't have to know how to break that soul tie.
Right.
That's a whole nother topic we can talk about
Uh-huh.
one day, Sarah.
You have
But
to
there's
come back.
soul ties, that are developed because of the blood relationship and growing
Uh-huh.
up together, and of course being intimate on a spouse level. And people need to learn how to break those soul ties.
I also think it's like I've got this with my sister. She's a half sister, quite a number of years older than me. She thinks the work that I do is I'm a do-gooder communist. She has no comprehension. Even if she
Right,
listened to a show, she wouldn't get it. Our worlds are very, very different. But when we do talk, or when I do see her, because she's in England, I hear him in Canada, we stay in one lane. What's the common
right.
denominator? What do we have in common? Both have three children, both love our grandchildren,
Yes.
both love this and that. Stay in that lane. Don't go outside of the lane because we know that's where the lava is, right?
Right,
Stay
right,
in
right.
that lane. And I don't put up with her when she comes out like that. And when she starts talking politics and goes down that road, I go, no, we're not going there. Let's stay in the lane. And if we stay in the
Yes.
lane, we can have lots of giggles, right?
Yes.
And I think that is it is um, she doesn't have the power over me, because I've actually said, that's it. I'm gone. I'm walking
Right.
right now,
Right.
even if I have to catch a plane home tomorrow.
Right.
And
Right.
then she immediately regrets what she said, but she
Right.
doesn't always filter
Yeah.
what she said. But you
Yeah.
have to know your boundaries and you have to
Yes.
show them the
Yeah,
boundaries.
exactly. Exactly. I think that's a big challenge, especially in the mental health world. People's boundaries have been violated for so long, it's become
Yes.
normal.
Yes.
And you see that a lot, even at a very young age. And that's the reason why I've always stressed in this healthcare conversation. I know we've gone in another direction, but we need to have better mental health care in this country, period.
100%.
That would fix a lot of the things with, what's going on in marriages, what's going on in households. We have a very, very deficient mental health system in our society.
And in our children.
Yes.
How many
Yeah.
children are killing children? And this is because they're feeling so disconnected.
Yes.
They're feeling so resentful. One person has to say something to them. This,
Right.
and then of course they watch the video games and the violent
Right.
games and the violent this and that, and they think violence, I'm just going to take everybody out and then that will
Mm.
solve my problem.
Right.
Right? And no, it
Right.
solves nothing. All it does is
Yeah.
creates more pain.
Yes.
Right? And that's the thing is we have to recognize the pain in our children.
Yes.
We have to look at it and validate it. Don't just say get over it, snap out of it.
Right.
Just that no,
Right.
we have to recognize they're in pain. How do we help them navigate that pain? How do we
Right.
empower them to be more than their pain? And we're not
Amen.
giving
Yeah.
that attention to our children.
Well, that all starts with love. And I think we've
Yes,
trying to make a living, trying to be rich and trying to be successful and have great careers. To me, the most important thing we could ever do is make sure our next generation is healthier than we are, as better off,
exactly.
and not just financially better off, but mentally and spiritually better off. So a commitment I made on a personal level right before I met my wife, Kathy, about the type of woman I wanted to be with. That was the
Hmm.
decision I wanted to make. I wanted to break that curse that was in
Mm,
my family, the stuff I went through. I don't want my children that I'll one day bring into the world experience that same type of
yes.
trauma. So that was a conscious decision I had because I couldn't help my parents or
Right.
lack thereof. I couldn't help the abuse that I went through as a child and a teenager, but I could do better for my next generation. And I
Exactly.
worked at that diligently. I took classes on how to be a father before I was a
Mm,
father. I took classes. I went to a seminar in DC one time with Dr. Miles Monroe. You may have heard of them, but I
hmm
went to a seminar on how to be a man and how to be a husband. I actually went to a
mm,
seminar before I got married my wife, Kathy. I did all of this by design. I took a conscious effort to be a better man myself so I could be a better husband and a better father. And I have three amazing children. One
mm,
graduated from West Point. He's a pilot now, flies
mm,
Blackhawks. My middle child, Jeremy, he's done well. He's a graduate from Kelly School of Business, already has his first job on Wall Street. And I got my daughter, she just started nursing school in Tampa, Florida. And I've never had a challenge. Kathy never had a challenge out of them whatsoever. It's because we poured that right kind of love and guidance and leadership in the right direction. We made sure we always took from the church. We make sure they got that developed. We always prayed together. We still
mm,
do it today. We pray over our food, and people look at us in restaurants like, "What are you guys doing?" I'm like, "We're praying over our food." We want to make
mm.
sure we're, no matter what, we stay connected. One thing I was taught when I was young, a family that prays together stays together.
And you know, your children won't need to go and take any of those seminars because they have a reference. It's the children that don't have anything to refer back to, right?
Yes.
My dad died when I was 11, so
Oh,
there wasn't that
sorry.
parent there. My son really didn't have a strong father, and kind of
Yeah. Right.
absolute and just not that kind of, and he had nobody else around him. He
Right.
made some decisions I didn't like, and I said to him, I love
Right.
you, I will always love you, but I don't like who you've become, and I don't
Right.
condone your
Right.
choices right now, but they're yours to make.
Right.
But I'll still love you, and I'm here for you when you're ready. And
Right.
eventually he was ready, and now he's the pillar of his society. But
That's
there
good
was,
job,
yeah,
Mom.
oh yeah,
Good
well, no,
job, Mom.
that was
Good
him.
job, Mom.
But
Let's
it,
go, Sarah. I love it.
the
Good
common
job.
denominator there was, um, I love you. No matter your choices, I love you. I don't
Am-
like your choices. I
mhm.
love you. And that love was the thread. That
Yes.
the love was the
Amen.
eventually decision when he was at a crossroads. My mum loves me. I can't make this choice. It'll hurt her. Right.
Yes.
So love was that crossroads of coming
Right.
back to love. And I think
Right.
that we don't have to approve of everything our children do. We can set boundaries ourselves with our children, um, and teach them how to understand their
Right.
boundaries and call them out when they're making, look, your choice, but you understand consequences. Because I don't think we talk about consequences enough.
Right.
When a child is doing something like, if you do that and you fall, this is what could happen. So be careful what you're doing, be
Yes.
mindful, right? We teach them that, but we don't follow it through in their later
Absolutely.
years. And I
Yeah.
think that, going I live in an area where unfortunately there's way too many young people on the street, and they're obviously taking meth. They're completely bent over, and they can't even stand straight anymore. And I
Right.
look at them, and there's so
Yeah.
many young men, young women, and it breaks my heart. Who was not there for them?
Right.
Now, I've done an
That's a
awful lot of shows on addiction where for
yeah.
some people you
Yeah.
can't help them because
Yeah.
that's their path. But
Yeah.
most of the time we could be there if only we had more
Uh,
resources on that.
yes. Well, it all, like you said, starts in the household, but like your situation and mine, I didn't have a father, and but I'll recommend to your audience, one of the best things I've done for myself and others, regardless of the challenges you dealt with as a child. I mean, a lot of people had alcoholics in their family, drug
Yes,
addicts in their family,
yes.
mentally abusive addicts in their family, mentally challenged addicts in their family. I would highly recommend, I'm sure you heard of the organization, join Al-Anon. You heard of Al-Anon?
No, actually, I haven't.
Al-Anon was started many, many years ago for the wives of alcoholics that were part of uh, Alcoholics Anonymous. And it
Mm,
was started by, Bill W.'s wife to support the wives. And it grew into a family support system for people who are dealing with childhood grief, young adult grief, and dealing with either siblings, their parents, or the community that they're in. And it's, get this, guess how much it costs?
zero.
It's zero. Costs
Mm,
nothing. They ask for
as
a
it should
dollar or
be.
two donation,
Yes.
and you can do it online. They have online classes. They're about an hour, and they have face to face. I'm gonna tell you, that was probably the greatest blessings I did to myself.
Mm.
Fell onto it by accident because when I went to the first Al-Anon meeting, I was looking for a guy named Al with the last name Anand. I'm like, they're like, what are you trying? I was dressed in a suit. I'm looking for Mr. Out and I. They started laughing and they told me what the acronym was about. It's like, no, it's a support group. It's a 12-step program. I'm like, oh. And then I remember the best part about it at the end of everybody's share, because like a share session.
Mm.
And you have veterans that have been in the program for 20, 30 years. You have newbies like myself. They kept saying this after everyone talked. They said, thank you for sharing. And I
Mm.
heard that like a dozen times. Thank you for sharing. Thank you for sharing. So at the end of the session, I'm like, by the way, who's Sharon? Can I meet her? She sounds like a great lady. Is that like some kind of spiritual guru? They cracked up laughing. I'm like, but I thought there was a lady called Sharon. Because they were sharing their stories of abuse and challenges and how they overcame it. So, but definitely check out Al-Anon. It's a great support group, and it's done wonders in our world.
And that's what we need more of. I interview an awful lot of veterans, and I'm not
Yes.
pro-war at all, but I have such admiration for them when they come back and realize I'm not getting the support I need. So I'm going to create it. And they have then created programs that have not only supported other veterans, but other families and communities. And, the thing is, they have the discipline, they
Hmm.
have the ability to pivot, they have the ability to seek out what they need to know, and they're
Right.
doing it from the heart and understanding. And
Yes.
so they've gone on to do some incredible things for their community
Yes.
based on their needs and what they needed for themselves.
Yes.
And I think that's always where the greatest program is and the greatest coaches are those that I faced the darkest night of my life. I had to go through the process, come out the other end, but I found my courage, my strength, my abilities, and my purpose, right?
Amen.
And
Yeah.
that's when you then can become the teacher.
Yes. Well, one thing you said about veterans is something in our organization we specialize in and helping
Mm.
veterans. Veterans have probably suffered the most with our biggest crisis, the mental health crisis.
Yes.
Think about what these young men and women had to experience. Many of them saw
Yes.
things that we couldn't even imagine. And
Right.
they come home and they have to deal with the stress and the anxiety, and they're not getting the help. Matter of fact, a few years ago, there was a record number of suicides amongst veterans. Literally, veterans actually committing suicide in a VA parking lot to make a statement
Right.
of the abuse they were dealing with mentally. And so that's something we pride ourselves in my organization in terms of helping veterans navigate healthcare, especially
Mm.
those that become retired. We help them understand how their VA coverage works. We also help them understand how it works with their Medicare plan, how they
Mm.
go hand in hand together to give them the best quality life possible. For example, I've had many veterans tell me it's like, it took me forever to get in to see a psychiatrist, with the VA. There's a waiting list. Some of these guys need
Yes.
help now. So when we
Uh,
put them in a Medicare Advantage program that has online services or at need services at that moment, it totally transformed their life. So I tell
Yeah.
all your veterans on the call, look into that because there's different options there that can help veterans in need. Because I love our veterans too. My son is a veteran. I grew up in a veteran family, so we wouldn't be where we are. We wouldn't have the freedoms we have without
Right.
our men and women of service.
Exactly. And that's even the frontline responders as well. And there's only
Yes,
so long they can do it before the saturation of what they see and what they go through
yes,
comes back to bite them. And I think actually
amen.
ultimately that what kind of killed my father from fighter pilot in the war. And they, of course, you
Wow,
know, true British things, suck it up and think of England and move on. And there was no
right,
downloading
right.
of the feeling and coming to terms with it. And eventually it ate him up from the inside out. And I think this is the thing is if we can't support the people that have been supporting us, parents, grandparents, community, veterans, first responders, our nurses, our doctors, our teachers, if we can't support them, then what are we as a society?
I
We
agree.
support them, we're a healthier society, right?
Yes.
So,
A lot of spiritual wounds there.
yeah,
And we're spiritual beings before we're human beings. There's a spiritual aspect
100%.
that needs so much nurturing and so much care and love. And that's why I mentioned Al-Anon, because it's got a lot of spiritual aspects, a lot of mental aspects that people can get help. So that's a great avenue. And there's others out
How
there.
do you
That's just the
spell
one I know.
that? How do you spell that?
All right. AL-ANON. Al dash Anon. ANON. I had to write it down to make sure I had the
Is it
acronym
dot
right.
com?
Yeah, there should be a .com firm, Al-Anon. It's in every city and state, and it usually partners up with a local AA office or facility. A lot of them do it through churches, like when we used to do meetings in churches, but they do them in libraries, pretty much anywhere where anybody can meet. And the good thing about it is no charge. And you got proven people in these programs that have been through, there are veterans there. There's people going through abuse as a child. There's abused women. They're all there showing how they overcame this mental and spiritual crisis they were dealing with. And it's just a 12-step program. And at the end, like you said, in terms of leadership, at the end of your 12-step process, you're supposed to go out there and sponsor someone else in need. You're supposed
Mm,
to pay it forward. That's one of the biggest things I loved about it, what it did for me after I had all the 12 steps down and did a second one, did a third 12 step, then I was able to be in a position to help counsel others that are going through similar crises. I had a gentleman one time, I was in a Monarch restaurant in Dallas where our main office is. And he sat beside me, good looking gentleman. I mean, the guy looks like a supermodel. He sat beside me, about the same age, and tall, dark, and perfect 10. We started talking, and within minutes, he's like, "Yeah, I came here to kill myself."
mhm,
I said, "Get out of here." He goes, "Yeah, I'm from here. I live here. I moved." I said, "Why here?" He goes, "I'm gonna get myself drunk. I got the gun in the hotel room. I'm doing it tonight." And I talked him out of that. I
mm.
walked him through the process. I spent several days with him, talking to him over the phone, got him involved in Alan, got him involved with a life coach. Now he's on cloud nine. He's
Mhm.
living the life of his dream. What if I wasn't there at that time? I truly
Exactly.
believe that God brought us two
Serendipity.
together
Yeah.
at that
Yeah.
moment because he
Hmm.
was serious. The stuff he
Yeah.
was going through was traumatic, and he was ready to end it that day. So that's one of my most proud
Hmm.
moments that I was able to do my 12 step, be a coach and a leader for someone else that was hurting, that was in pain.
And the thing is, it's not about how many you save. It's that one that you save that then goes on to saving another and another and another. I think we've got to stop reaching for the heights and start bracing the arms,
All right.
the ripple effect, because that ripple effect has so much
All
more
right.
impact. And if you empower one person, then they empower another, and so on and
Yes.
so on. So,
Well, it's like these mass shooters. Can you imagine if someone would have stepped in with
yeah.
that person that's going to blow up, a community center or, be shoot people, innocent people. So we can all step up and do better. What if it
This,
was just a neighbor? What if it's just a guy in passing? Guy doesn't look right, doesn't look well. Just ask, are you okay?
uh-huh,
You need to talk. And that's how I did with him. He didn't seem right. I'm like, are you okay? And we just started
yeah,
talking. He told me his troubles,
yeah.
and
And all he
you know,
needed was someone to care.
that's it.
Yeah.
That's it. And we're good friends today. He reaches out, tells me his progress every now and then.
Mm-hmm.
He's in his mid 50s like I am. And
Uh,
it's amazing. You figure this guy who was a multimillionaire, lost it all, marriage went to crap. He was about as low as a man could get,
total bottomed out.
and he bottomed out. Now he's on the way back up again. So
Right.
I
And
just
that's
wanted
the,
to share that.
No, that is wonderful. And those are the kind of stories that I love to hear. And, also very much the kind of people I get to interview. Some of the people have gone through things that no human being should ever go through, but they made the choice. I
Yes,
am not the victim. I refuse to stay the victim. I'm
yes,
going to empower myself. And then
yes.
they become those leaders that help other people through with those traumas. And it was interesting. I was watching, I think Boston Blue, I think it was that show, and they had a kid that killed three teenagers, and they ended up arresting the parents because the parents knew the kid was on psychotic drugs, knew the kid had
Wow.
problems, and instead of really paying attention to the warnings that this child could go out and help them, we're kind of just brushing it under the rug. And they eventually arrested the parents of kind of neglect because we have to teach parents to see the signs and not dismiss them, right? Now, don't go all, kamikaze on the kid because they could just
Right,
be an introverted kid, but at the same time recognize what is going on. And
right.
when a kid starts isolating themselves, then there's something wrong. It has to bring them out.
Yes,
And if you can't talk to them, find somebody else to talk
right.
to them,
Amen.
right? Because
And I don't,
let's catch the stitch in time.
yes, and I agree with you 100%, Sarah, but also I think we're over medicating our children.
Oh,
Uh,
100%.
yeah, we didn't have all those drugs in the 70s. That we have
Yeah.
challenges, we have
We
problems,
work
but
through things.
yeah, but nowadays they just throw medication at these kids, and then they wonder when they turn 16, 17, 18 years old after 10 years of these
Mm.
psychiatric medicines, they're worse off than if they just got quality love and therapy that the kid really needed.
And of course, if somebody's really severely bipolar, then yes, they're
Sure,
going to need that. So, if
sure,
they've got schizophrenia, yes, they need that. There
sure.
always are the extremes. But I think what we've become is too happy with the drugs as the band-aid. Oh, just take
Yes.
this drug and that will take
All
care of
right.
the problem. Root,
Sure.
root, root. What's the root
What is the
cause?
root?
What's the
Yes.
root cause? Pay
Yes.
attention to the root cause.
Amen.
Now, how do people get hold of you? Um, if they're interested in talking to you about, this whole program that's going on right now, they want to have a
Sure.
chat with you,
Yeah.
and they want to know more. So, where are
Sure.
the areas?
So I do offer my phone number. I've had people reach out via text, and I'm always open to help someone that's in need. What I'd like to do is help them find, what I've been doing lately is helping people find the right broker that help them through the healthcare crisis, whether they're on Medicare or whether they're on ACA or if they need help with their employer coverage, helping giving them a second opinion or the appropriate guidance they need. So we have thousands of brokers. I mean, we have over 600,000 total brokers in our entire company. They can find me through globalpremierbenefits.com. They can also find me through my Instagram account. They can DM me anytime, the Tony Holland. And they can also call me direct. I'm also on LinkedIn, and my direct phone number is 443-253-3634. And what you'll be surprised, Sarah, people say, you actually picked up the phone or you actually
Mm,
answered my text. I'm like, who does that? He goes, you're
mhm.
running all these companies. I mean, I have three AI companies, two private equity companies. I'm in the insurance business. I have a major operation there. I own a sports franchise, minority owner of a sports franchise. And they go, where do you find the time? I'm like, for people, you make the time,
Yeah.
you make the time. If someone's in need and needs help, and it could be as simple as Tony, I need help with an agent. I live in Birmingham, Alabama. Who do you know that can give me guidance? Boom, I can link them with someone I know that's qualified. They can give them the advice, tell them what you need to do, and also make sure they avoid the common mistakes like like auto renewing. Don't auto renew your plan. Check it out first before you let it roll over to the next year. Don't always focus on the premiums. Look at the full
Mm,
picture, as I said earlier. Look at the network status. Okay, that's important. People overlook that. They forget about the subsidies. Go to your tax professional and know what your modified adjusted gross income is to see if you qualify for a subsidy. And don't forget the deadlines. They're coming up soon.
yes.
For Medicare, the deadline is December the 7th. So be here in a couple weeks. For ACA, the deadline is December 15th. It'd be cool if they can get them all the same deadline, but they haven't done it.
Yeah,
Our
exactly.
government seems to complicate things more than they need
Of
be. It'd be nice
course,
to
of
just have
course.
one open enrollment period for all the plans. But
Right.
anyway,
And of course, if anybody's listening to this show down the road, there's always next year. And it's like still
Yes.
inquire, because if you miss the deadline this year, there's always next year. When is that going to be? What do you need to know? Reach out to Tony and he'll help
Yeah.
you navigate through that. And, I hope you don't mind. I'd like to put allon.com on your
Right,
page as
right.
well.
That's fine. That's fine. And the one thing for your audience too, there's other enrollment periods. For
Mm,
Medicare, it's annual enrollment period now, but they have what's also called open enrollment period, which starts in January. Okay, so
right.
it's not all lost. That goes until March the 31st. Then they have what's called special election periods. ACA has that as well. And that's why it's always important, like I said in the beginning, work with a certified and quality health insurance professional to help you navigate all this.
And it's perfectly right for you to contact Tony and say, I have no idea what I need, no idea what I want. I have these are strange waters for me.
Yeah,
Help me navigate what I
right,
need, because nobody expects you to know it all. That's what he's
right,
there for. He's going to make
yeah,
sure that he helps you get to the right broker and gets the right coverage that you need without you going bankrupt on it,
right.
and one that will deliver when you need it to.
Yes, it's all simple needs and analysis the broker would do with them. They're going to ask them appropriate questions to kind of navigate. Does she need this or does she
Mm,
need that? Does she not need this part or would this be a better option for her? That's why make sure if you don't work with us, if you work with another quality broker, make sure they do a full needs analysis. It's like going to the doctor. You want them to check your temperature, check your heartbeat, check your ears, check your eyes, check your throat, because there might be other challenges we don't know
yes.
about that give you the help and quality care that you truly need and deserve.
And the other thing is, know when it's an upsale and whether you need it or not.
All right, exactly,
Right. So
exactly.
learn to be a little savvy by paying attention.
Yes.
Right. So
And
this
don't be
is
afraid to ask questions.
no, however
Ask
stupid
as
they
many
are, it doesn't matter.
questions.
You
And
don't
it's
know what you
okay
know
to
until you know
say,
it.
let me
Yeah.
call you back again next week, or let's set up a second time. It's okay to do that. You don't
Yes.
have to. There is a deadline, but that's why
Mm,
you should be shopping now. So
mm,
that way you have time to investigate, look at it, get a second opinion maybe before you make that final move. Because once you're in, except if there is a special election that you qualify for.
exactly. This has been a wonderful conversation, and we've covered a great
Thank
deal.
you.
The
Yes.
fundamental, yes, insurance can cover medical needs, right?
Right.
But the other insurance is connecting with your heart, soul, and spirit and bringing that to the community, and understanding that if you really want to avoid, the ambulance and the medical needs, bring the community together and be there for each other. And there's an awful lot of love medication you can take from a community,
Yes.
right?
Lots
So
out there.
it's all out there. And it's just a question of like somebody stepping up and saying,
Yeah.
let's do this, right?
Yes. A big virtual hug to you and your audience. You guys have been great. And I wanted to thank you guys for having me. It's been an honor and a privilege, Miss Sarah. This was more than I expected. You guys some amazing. It was a great conversation. I really, really enjoyed it. It was
I
a
really
blessing.
enjoyed it too. And everything was falling under the umbrella of
Yeah.
our own health and well-beingness. We've got to
Yes.
put that well-beingness and the wholeness of us first.
Amen.
And then we will just have we have such a dysfunctional nation in the world right now. And we really
Yes.
need to get humanity back on track. And that means that we've got to come together. So
Amen. Thank you so much.
thank you so much.
Take
Until
care.
next
God
time,
bless.
folks, bye for now. We hope that you enjoyed the show. There are so many more for you here on selfdiscoverywisdom.com. Just go to the podcast tab at the top there and you will see all the many genres and all 3,000 shows ready for your listening. We are here to serve you, to help you on your journey of life, and we know that through inspiration it begets invitation. We are supported by you, the listeners, and those that we interview. Anything that you can spare us in donation would be greatly accepted, and we do hope that you enjoy the next show.